health. As Giles said, we spent, well, the Western world spent $600 billion in the last 10 years, and there is no new hospital being built, there is no strategy for taking care of the civilians in Afghanistan. So you spent almost 2 years in Panjshir Valley. Yes, just tell us what is your assessment of the situation there and how important is the work emergency is doing.
Yeah, thanks again for giving me this opportunity to tell you what's going on in Afghanistan. I think it's really, really important that messages are coming out of the country, and what Giles is doing with this documentary and these pictures, I think is really, really vital. Afghanistan, we know, it's more than 10 years we are in war with Afghanistan, and it's becoming almost kind of a dull thing. Sometimes news comes up, somebody dies, something happened, there's a bomb explosion, somewhere in the countries, and we are not really putting too much attention to it. I would like just to tell you what's behind all this picture you've seen here. And what actually what you're seeing here is the only things that people are getting in that country, which is incredible when I had the opportunity to go there and to see with my own eyes things that I wouldn't even think of. In terms of, as we say, public health, in terms of, I would say, human rights to be cured when something is wrong with your health, which could be some complication from delivery. I'm a midwife, so of course I was focused more on that part, but a simple appendicitis or diarrhea or things like that. Emergency, I just want to talk a bit about the association and what we're doing so you can get a better understanding also on what is our action there. As you probably all know, emergency has a long story in Afghanistan, and actually up to date, emergency is the only NGOs, but the only institution who can actually say, as hospitals in Afghanistan, is providing care. The 3 hospitals in Afghanistan that we have are the only centers that are able to treat patients. The first one, the emergency opened, well, let's take a step back. I think basically you all know, but emergency was born in 1994. As Giles mentioned, it was probably like a personal will of a group of surgeons who had different experience with different NGOs around the world in developing countries. And it's true that sometimes you see things that are not right, how the monies are spent, how the resources are used. So you go from the headquarters where you see that level is absolutely stunning, and then on the project you don't even have gloves or lights or basic equipment to perform what you have to do as a health professional. So the aim of emergency since the beginning, and as Giles mentioned, it was like, why a developing country, a low-income country? Why, because you're poor, you should receive a lower level of care? It's just not right. If you're sick, you're sick, and if you need a treatment, is that treatment based on clinical evidence and what is right to do for your health in that moment. So since the beginning, emergency started the project building or refurbishing hospital or working in partnership with other hospitals, always pursuing this kind of target, high quality, free of charge, surgical and medical care. In Afghanistan, the first hospital was opened in 1999. Gino Strada, the founder of Emergency, was personally friends with one of the most famous icons in all Afghanistan, which was Massoud. He was a commander and was the head of the resistance, first to Russia, afterwards to Taliban. And he was based in Panjshir Valley, which is these mountain areas about 2 hours driving from Kabul. He decided to go and open an hospital there because in the whole region, because as we say, that area had never been conquered by Russian or Taliban, so you can just imagine how much isolated they were. I had the opportunity to meet Gino Strada because he came to visit our hospital in November, and he was telling me a story that to go from Panjshir to Kabul, that today you take like about 2 hours, one time he had to go through Pakistan, and it took him 6 days to reach Kabul, and then I don't know where was his next step. So you can just imagine how was the condition, the living condition of the population there. Very rural area, very poor area, and history of fighting for years and years and years. So they went to build a hospital, which is still running and actually is one of the biggest and busiest hospitals. They refurbished an old, it was a school for army or something like that, so we had the buildings and they refurbished from scratch, from zero. And it was born at the beginning as a war surgery center because what they were facing, they were casualty from fighting, from landmines, because Panjshir is one of the places with higher numbers of mines scattered all around the area. And then this was in 1999, so quite a long time before the world's attention was on Afghanistan. It was a forgotten place. Nobody even heard about Afghanistan before that. So emergency always strive to go and reach basically forgotten places, forgotten people, where people are dying from basic illness and nobody even knows that things like that are happening. After Panjshir Hospital was open a few years later in 2001, but before the 9/11 happened, they opened a hospital in Kabul, which was at the time under the Taliban rule. So, you know, emergency always brought a message of being neutral and wanting to care people just because they're human beings and not because they're belonging to Taliban or whatever political, ethnical or religious group. So in order not to create a disparity in treatment, they opened also the hospital in Kabul, which is still running up to date. And in 2003, so when the Americans and the international forces arrived in Afghanistan and Kabul was free, then they went in the south part of the country, in Lashkargah, and they opened their third center. Again, still running, very busy still, under the Taliban rule up until now. So these three hospitals, as I mentioned before, they're doing an amazing job. Kabul and Lashkargah are actually just war surgery hospital. They have about 100 beds on average, although number can raise quite a lot on busy times, especially on summer, because it's when the fightings are taking place. During the winter time, especially in Kabul, there is snow, people are actually moving less around, so also the fighting is less. And in summer, I think last year we had the busiest summer ever in Kabul. It was, they had for 2 months the laundry almost stuck with beds, which is not usual. We try always not to do like that, but they couldn't cope with the amount of people arriving. But I don't think any of us really heard these things in the news. They receive more civilian casualty now than they used to do under the bombing of international forces, where they were all under worldwide attention. So the problem is still not solved. And as we said before, all these years of international presence in the country didn't change at all the public health condition. Actually, I think it's worsening it and it's creating a vicious circle of lack of services and also people not even seeking care. What happened is very common things like Giles witnesses. People are just not having health facilities around them. Emergency, in order to help these people to reach our facility, we opened 27 first aid posts, which are basically small clinics where we provide first aid care. Usually we stabilize patient who arrives there, and we provide free transport to the nearest of our hospital. So we try to open these clinics as far and as any remote areas, so that to reach the population who doesn't have any car, where the roads are not really good, and we can ensure that if they're sick, they can come to our hospital.